Hi, everybody. My name is Martyna Erskine. I'm a family nurse practitioner here at J Wellness Partners. And today I want to talk about testosterone. Specifically, why do we need testosterone? So all the benefits of it. I was going to talk a little bit about the treatment and what we offer here in the clinic for too high or too low testosterone. However, there's too much to say about the benefits of this hormone. That's why we will do a separate lecture after this one, where I will go over all different type of treatments of testosterone deficiency, natural and also medications. So let's start it. So what is testosterone? Testosterone is a hormone. It's actually anabolic steroid hormone. So it's from the steroid family. All the hormones from steroid family starts with cholesterol, and cholesterol turns into different hormones, and that's how testosterone forms. I will show you the whole chart of the steroid hormones later. Anabolic means builds up. So it's a hormone that helps us build up muscle, builds up proteins in our body, opposite to hormones that are catabolic hormones that breaks down stuff. Example of catabolic hormone will be cortisol. So like I said, it's derived from the cholesterol family. It's mostly for men. It's excreted in testes. Almost 100% of testosterone is produced in testes. However, for females, 25% of the hormones it's produced in ovaries, another 25% in adrenal gland, and a half of the testosterone is actually produced in peripheral tissues. So like I said, the functions are the anabolic effect, increased muscle mass, bone density, bone maturation, and also androgenic effects. Androgenic, which is male hormone effects, and it affects development of sex orgasm, deepening of the voice, hair growth, etc. So testosterone it's a big molecule, so it cannot just go to the bloodstream. It needs proteins to be carried. So there are two carrier proteins. First one is sex hormone binding globulin. That's a protein that inactivates testosterone. So once testosterone binds to this protein, it's kind of the inactive form of the hormone. And another protein is albumin. Sex hormone binding globulin is responsible for about 2/3 of the carrying capacity, whereas albumin is about 1/3. It's very important to know that only the unbound portion of testosterone is able to have any biological influence in our body. Because of that, we have 3 different forms of testosterone. We have a total testosterone, that is all the testosterone in our body bound and unbound to proteins. We have a free testosterone, that is the one that it's not bind to sex hormone binding globulin and not bind to albumin. And we have also bioavailable testosterone. A lot of labs measure bioavailable testosterone. What does it mean? It's a testosterone that it's not bind to sex hormone binding globulin. However, it could be bind to albumin and also accounts for the free testosterone. So it's not really necessary to measure bioavailable testosterone because, like I said, the free one, the unbound one, it's the one that does have an influence on our body. And the free testosterone accounts only for about 1 to 3% of testosterone, total testosterone. So sex hormone binding globulin, like I said, it's a protein that carries testosterone for bloodstream. Also, it carries DHT, which is dihydrotestosterone, also the bad testosterone, and also carries the E2 estrogen. If it's too high, then too much testosterone is inactivated, and there is less testosterone estrogen available in the body. So sometimes low testosterone could be due to high sex hormone binding globulin. That's why it's very important to measure both. When it's very, very low, there's more testosterone and more estrogen available for usage. That often happens in women with PCOS. And also very, very low sex hormone binding globulin is very often a marker for low thyroid function. So that's the production of testosterone. So first, let's look at the picture on the left. So first, there is some behavioral effects in our brain, and our brain gets activated, specifically hypothalamus, And hypothalamus, in response to low testosterone, will secrete gonadotropin releasing hormone, and that gonadotropin releasing hormone would activate anterior pituitary gland specifically. And in response to that, anterior pituitary gland will increasing more LH, luteinizing hormone, and FSH, follicle stimulating hormone. And then they go to testes or ovaries and stimulate testosterone production. So that's the brain response to low testosterone. And that's how the production starts. It starts with cholesterol. All steroid hormones are produced from cholesterol. Then it goes to pregnenolone, and then we have DHEA, and there's this testosterone. So I really want you to pay attention to this. Testosterone can convert to DHT, which is dihydrotestosterone. It's kind of called the bad testosterone, and I'll explain it later why, via this 5-alpha reductase enzyme. Also, testosterone can convert to estrogen. There's very, very similar chemical compounds, and that happens because of the aromatase enzymes. And that can happen to a lot of people on testosterone replacement therapy. Their body is confused getting so much testosterone and can aromatize it to estrogen. And then people tend to have estrogen dominant symptoms if the dose was too high or if the body was too much in shock. So we will also talk about it on the next webinar, how to block that naturally, the aromatase enzymes, and how to also block the 5-alpha reductase enzymes to keep the testosterone level nice and high and estrogen and DHT a little bit on the lower side. So there's also one more testosterone called epitestosterone. It's like an epimer of testosterone. That's like structurally it's identical like you see, but not a mirror image. It's also made in testes, however, it has non-androgenic effect, so does not have any effect that testosterone does. And then it's a useful marker mostly in some patients, specifically for some Asian male patients, because they can have a falsely low testosterone. However, the epitestosterone can be normal, and it's just like a SNP they have in their genes that it can show testosterone very, very low for Asian men, but doesn't mean that testosterone is actually low. That's why it's very, very important to measure epitestosterone for this type of population. And now we have DHT, dihydrotestosterone. Some people call it the bad testosterone because it does a lot of things that have a bad effect on our body. However, it's not necessarily bad. That's one good thing. It's responsible for libido. So if we have a very, very low DHT, very often we don't have a sexual drive. It's very, very potent. It's actually 3 times more potent than testosterone, and it's made from testosterone via conversion via 5-alpha reductase enzyme. It's responsible information on male sex-specific characteristic and development of male genitals and prostate. So it's produced in embryo, in utero. Yeah, like I said, low level can affect the libido and sexual function. However, if DHT is too elevated, and that's very often genetic, so some people genetically convert testosterone to DHT more often than other people. That's why a lot of men that once they turn age of 35, 40, they start having male pattern balding, which is called androgenic alopecia. Not every man is balding with age, so it is very genetic. Those men convert their testosterone to DHT, and DHT is responsible for that balding. For females, very often it shows as acne, especially like back acne or like jawline acne. It also calls hirsutism, which is overgrowth of hair, which is kind of interesting, that makes us grow more hair on the body, however, less on a scalp. It's responsible for enlarged prostate cancer. So some people are, like I said, genetically prone to convert testosterone to DHT. There's a couple things we can do for those people if they want to still try testosterone replacement therapy because their testosterone is low. We can put them on medication, which usually it's not the first form of defense. We try to do natural supplements like palmetto, beta-sitosterol, L-lysine, green tea. It's really, really good to block that conversion. And there's a couple herbs that are really amazing in blocking conversion of testosterone to DHT. And then last resort are usually medication like finasteride and dutasteride. So what are the symptoms of low testosterone? How do you know if you have low testosterone without measuring it? Symptoms are, so like I said, testosterone is anabolic hormone, which means builds up anything in our body. So low testosterone usually goes hand to hand with wasting, like muscle wasting, fatigue, low libido, for men, erectile dysfunction. That's like a last thing to go, and I will show you in the next chart. However, erectile dysfunction is number one cause for men to be eligible for testosterone replacement therapy. However, when they already have erectile dysfunction, very often it's too late almost, like the testosterone is very, very dramatically low. So that's why it's better to treat it before it will even get to that point. However, it's the number one cause why men actually are eligible for testosterone replacement therapy. So decreased energy, diminished interest in exercise, diminished interest in any type of movement, difficulty maintaining muscle mass, osteoporosis, and that's really, really important. So osteoporosis is those holes in the bones. And that mostly affects women because men, young men, they have testosterone in level of 1,500, 1,200 nanogram per deciliters. However, women tend to have in 200s when they're very, very young, and then it drops every year. So for male, when you start with 1,000 and slowly dropping every single year, then when you're older, men tend to have testosterone in their 200s. However, women tend to have their testosterone around 10, 20 nanograms per deciliter. And that's very, very important. That's why elderly women, when they're in the nursing homes and they fell, they end up in hospital and they need hip replacement because they end up breaking up their hip bone. It does not happen as often for elderly males because their testosterone pool is higher to start with. So osteoporosis really affects females just because we already start with like lower level of testosterone. So it's a really serious condition. It can cause a lot of complication, and especially surgery in a certain age. It's a high risk for mortality. Also, low testosterone symptoms are like weight gain and mental one, like low self-esteem, anxiety, memory is not as sharp. People also don't sleep very well. Men has difficulty achieving and maintaining erection. There's a reduced testicle size for men as well, low sperm count, poor sperm quality, and even infertility. If it comes to muscle wasting, it's not only muscle wasting. People tend to like lose lean muscles and gain fat easier when the testosterone is low. Also, men can have a gynecomastia, which is growth of the breast tissue due to low testosterone. And other symptoms of low testosterone we can visualize, like thinning and dry hair, dry, thin skin, poor elasticity of the skin, droopy eyelids, thin lips, and saggy cheeks. The symptoms can be very subtle at first, but they can lead to significant health issues over time. That's why it's very important to address low testosterone before it's too low. So this is very interesting picture. It shows how it's based on men's testosterone levels. So like I said, when men are younger, their testosterone tends to be 1,500, 1,200. Then once they turn 30, testosterone drops by 1 to 1.6% every year, and starting at age of 30. However, it's very individualized. Here in the clinic, we see a lot of patients that have very high stress jobs like special forces, Navy SEALs. Those men tend to have a way lower testosterone levels than regular men, like with regular jobs, just because of the stress level. Because like I said, cortisol, it's a catabolic hormone. So cortisol is anti-testosterone, and more stress and cortisol we have in our body, less testosterone available we have in our body, and also less thyroid function. So this is very important to see. Once you see men's testosterone levels drop below 900, they're more prone to Alzheimer's disease. Once it goes lower and lower, they're more prone for mortality, metabolic syndrome, osteoporosis, type 2 diabetes, coronary heart disease, fatigue, libido. And like you see, the last thing to go is erectile dysfunction, because even though everything going bad in our life, men still should be able to reproduce. That's why erectile dysfunction is the last thing to go. When the testosterone levels are around 231, this is when men start having erectile dysfunction. And that's usually the time when they go and seek help, which is very, very late compared to all the other symptoms. What about fatigue? What about low libido? So very often they're eligible for testosterone replacement therapy when they already have erectile dysfunction to too low testosterone. However, this is like a last thing to go. So it's better to treat it before it will get to that point. So what can cause low testosterone? Number one, it's age. Like I said, it drops by 1 to 1.6% every year since we turn 30. Menopause for women also drops all the hormones, not just testosterone, but also progesterone and estrogen. Childbirth can also lower testosterone, so chemotherapy and the toxins. Adrenal stress or burnout, cortisol drops testosterone levels. You would think that a lot of athletes has a higher testosterone because exercises, especially weight exercises, can increase your testosterone. That is true. However, a lot of athletes, they add competitiveness, and that adds stress. And very often, a lot of athletes burn out their testosterone much faster just because of the stress element in all those competitions. Social habits. So social habits that lower testosterone are like diet, smoking, alcohol consumption can lower testosterone, insulin resistance, also obesity, especially visceral obesity around the belly. Visceral means the obesity that's around our organs, around our waist. That's a big part of metabolic syndrome, and that really affects testosterone production. Also, more fat tissue we have, more prone we are converting testosterone to estrogen. And more estrogen we have, easier for us, and less testosterone, easier is for us to put on weight and lose muscle. So it's like a vicious circle. Toxin exposures can cause lower testosterone, endometriosis, depression, and a psychological trauma, TBI, traumatic brain injury. And there's a couple medications that also lower testosterone, like for example, birth control pills, statins, lower testosterone, and anabolic steroids do, beta blockers for heart, NSAIDs, which is like ibuprofen, and then those non-steroidal anti-inflammatory medications, and also SSRIs for depression can lower testosterone levels. So what about testosterone and other compounds? So like I said, it's decreased by cortisol. Cortisol, it's anti-testosterone, anti-progesterone, anti-thyroid. Testosterone with its nice balanced level can decrease blood glucose. That's why diabetic people on testosterone replacement therapy don't need as much insulin, because testosterone nicely balances their sugar level. Causes increase in insulin production, and also it's decreased by sex hormone binding globulin, the protein that attached to it and inactivates it, like we already talked about. This is exactly like the picture showing how high cortisol can drop everything. Drops our serotonin, which is happy hormones, melatonin, which is a hormone that helps us sleep. High cortisol decreases testosterone, and also cause brain shrinking, like hippocampus shrinking and muscle wasting. So stress. I already did one presentation about the cortisol and stress and how to manage, because it's very hard to tell people, oh, stop stressing out. It's easier to just give them solution, like how to manage stress and also how to protect your body from damaging effect of cortisol, which we talk about adaptogens and all of that on one of my previous presentations that's on our YouTube channel. So what if it's too high? Some people tend to have too high testosterone, women with PCOS or very, very young men sometimes. The symptoms are usually like anxiety, depression, insulin resistance, because there's too much insulin production, but it's resistant to it. Fatigue, hypoglycemia, because it lowers the glucose, increased risk of heart diseases, salt and sugar cravings, agitation, anger, some facial hair. Acne, facial hair acne, weight gains. Most of those symptoms are due to high DHT, dihydrotestosterone, not necessarily high testosterone, because once we have testosterone too high, it can convert to DHT, and that can cause a lot of those symptoms, like hair loss and unwanted hair growth. So how do we diagnose people with low testosterone? First, we do tests. So we can do blood panel test, which is from your serum, and that's a gold standard for testosterone. We can do saliva testing. Saliva testing is very useful for people that do testosterone topically, like in a form of creams, because when we apply cream on the skin, it gets absorbed to your cells before it gets absorbed to the bloodstream. So very often blood levels of testosterone that doesn't really show us if the testosterone level in the cells it's accurate, because first it goes to cells. So saliva testing is a gold standard for an topical testosterone replacement therapy. 24-hour urine testing, that's just to, confirm a low testosterone based on the blood test. And dry urine test, that's a very interesting, and that's an example how the dry urine tests look like. It doesn't really tell us if we have low testosterone levels in our body. It gives us metabolites of testosterone. So it's really, really important for people that want to know how they break down testosterone. It's very important to see which pathway go. We see this is this 5-alpha pathway. This is when it turns into DHT, the bad testosterone. So it's good to know which pathway your testosterone or androstenedione goes. Also, it's very important to see how much testosterone is converting to estrogen and make sure some men or women are not too prone to estrogen dominance. Also, dry urine test, it's really good to see metabolites of all the estrogens pathways, which I cut it out here because it's not relevant to this presentation because we're focusing on the testosterone. However, it's very important to see if estrogen goes to like the cancer causing pathway, or it's metabolized the right way and then methylated and excreted through liver and kidneys. So that's nice add-on to any blood testing. What's the baseline testing for testosterone? This is not necessarily baseline testing we do in Joy Wellness Partners. We actually do full hormonal panel for patient that we add a bunch of thyroid tests and comprehensive metabolic panel, all the electrolytes, liver, kidneys, total testosterone and free testosterone. Because like we know, sometimes total testosterone can be high. However, the free testosterone is low. Then we know that a lot of this total testosterone is being inactivated and there's not enough free testosterone that doesn't work in our body. Might be due to different reasons, maybe because of very high sex hormone binding globulin. So it's really important to check that. It's very important to check DHT level to see if patients already prone to converting testosterone to DHT. DHEA is a precursor to all those hormones. It's worth checking it. It goes down with age. So older we are, the less DHEA we have. Estrogen, it's always should be measured with testosterone to make sure men and women don't become estrogen dominant. LH and FSH, luteinizing hormone and follicle stimulating hormone. This is really, really important for men and women, because if somebody is supplementing with testosterone and then testosterone total and free gets super high, then and LH and FSH are very low, which are produced in our brain, it means our brain stimulation of testes and ovaries to produce testosterone drops completely because it doesn't have to stimulate them because this person is on external testosterone. However, if LH and FSH are high, however, testosterone is low, that means our brain is sending enough signal to testes and ovaries to produce testosterone. However, our testes or ovaries are sluggish. Then we know there's the cause of low testosterone. It's actually lays in the testes, not in the brain. And of course, when both LH, FSH, and testosterone is low, then we know that there is something in our brain that causes dropped production in hormones, and that might be due to TBI. That's what we often see, traumatic brain injury, that drop of LH and FSH that affects total testosterone and free testosterone. Prolactin, it's like a hormone that if it's too high, it can drop testosterone as well. So it's worth checking. CBC stands for complete blood count. That one tells us basically a quality of our blood, tells us the hemoglobin and hematocrit levels. So hemoglobin is the protein that sits on red blood cells and basically attaches to oxygen and brings the oxygen to all cells in our body. So that protein, if it's low, and hematocrit, the percentage, if it's low, people tend to have anemia. However, people on the testosterone replacement therapy have opposite. They produce more red blood cells, their hemoglobin production goes up, and the hematocrit goes up. So they have something opposite to anemia, which means more like a dense, thicker blood. And that's sometimes a side effect of high dose of testosterone. And it's very important to check it every few months, make sure hemoglobin, hematocrit are not too high, because if they are, it can cause headaches, sluggishness, and the treatment for that will be the blood donation or therapeutic phlebotomy, when we draw blood and we just discard it to kind of prevent any clot formation, because thicker the blood, the more prone people are to develop clots. And PSA, that basically checks for prostate enlargement. So why do we treat testosterone? All the benefits of testosterone, there's a lot of it. So number one reason people come, it's because of the sexual function, lack of libido, erectile dysfunction. That's the number one cause of people seeking help. Another one, vasomotor symptoms, which is like hot flashes, night sweats for females going through menopause. VVA is vulva-vaginal atrophy, which is atrophy of the genitals for females, and dryness. Body composition, people feel like they gain muscles, they gain fat easier and they lose muscles. So people seek testosterone replacement therapy for that reason, for bone health, to prevent osteoporosis. And some people like to be on testosterone because they need less insulin for the diabetes. Testosterone replacement therapy and cognitive function. High free testosterone was associated with better performance on tests of memory, executive function, and spatial ability. Also, testosterone reduced risk of Alzheimer's disease, improve brain blood flow, and improve spatial cognition and verbal fluency. If it comes to Alzheimer, actually prevents the production of beta amyloid precursors protein that actually leads to Alzheimer. That's a disease when those amyloid plaques in the brain are forming. So testosterone prevents that production. They were treating male patients that have Alzheimer's disease for 1 year with testosterone replacement therapy. And they have an improvement in their Alzheimer's symptoms compared to people that did not do testosterone replacement therapy. They did, that control group actually deteriorated. Testosterone atherosclerosis. Some people are really concerned of is testosterone causing heart issues. So they did some randomized placebo-controlled parallel group double-blind trials, and it proved that did not have any issue of coronary artery calcium score, or no distal right common carotid artery intima media thickness. So testosterone did not affect negatively our vessels. And testosterone and coronary artery disease and inflammation. Testosterone actually lowers the inflammation. So once it's lower inflammation, lower the inflammation locally in the arterial walls. And that leads to vascular smooth muscle apoptosis, and it helps veins not get so stiff. It's anti-inflammatory for the vessels, and that helps prevent cardiovascular diseases. Men on TRT versus not treatment had decreased in all-cause mortalities, MI, heart attack, and stroke. Testosterone and prostate. Testosterone replacement therapy appears to have little effect on prostate tissue. Actually, there was a study that proves that people might have more aggressive prostate cancer if their testosterone is very, very low. And the other study, low testosterone is associated with more aggressive prostate cancer. And then it reviewed 16 studies, and so was the placebo control, and they were looking at the risk of testosterone therapy, and there was no increased prostate cancer growth. And testosterone sexual function. So there's multiple reviews that proves that testosterone has a good positive effect on sexual functioning, including libido, erectile functioning, and overall sex satisfaction. And testosterone replacement therapy in men with low testosterone levels, ED, erectile dysfunction, and low libido shows symptomatic improvement in this men. Testosterone in mood. So testosterone, some people are wondering if testosterone increases aggressiveness. However, it's proven that testosterone potentiates wherever you have already in you. So if you are a very motivated and very hardworking person, it kind of makes you more motivated to do things. People are already very aggressive, that can potentiate that in them. However, for most of the people, it just potentiate wherever we have in us. So it makes us want to go to the gym, makes us want to work out, makes us help others. So it's wherever we have in us, it potentiates that. And actually, men with very, very low testosterone tend to be more aggressive than men with a high testosterone. It does improve mood overall. It improved corrected anemia, like I said, increases your hemoglobin production, which is protein in our blood, slightly improved walking distance, vitality, mood, and depressive symptoms, and also bone density and strength. Testosterone and quality of life. So study have reported reduced mortality for people that are on testosterone therapy, and improvement in quality of life with fewer sexual, psychological symptoms. So the conclusion. So testosterone is a really, really good hormone, very important for well-being females and males. It increases sexual interest, increases sense of emotional well-being, increases muscle mass strength, helps us burn fat easier, helps maintain memory. It's really good for mood, helps with skin sagging, decrease excess body fat, helps maintain bone strength, elevates norepinephrine in the brain, which is this motivational neurotransmitter that keeps us going. And there's no evidence that testosterone replacement therapy has any negative impact on cardiovascular diseases. However, there's a lot of evidence proving that does not. There's almost no risks. And then also low testosterone is associated more with increased risk of arteriosclerosis, cardiovascular diseases, benign prostate hyperplasia, and coronary artery disease. In part 2, we will talk about all you need to know about testosterone treatment, how we treat it here in the clinic, how we can do it naturally, how we can do it with peptides, how we can do it with testosterone replacement therapy, and all different options of testosterone replacement therapy. So that will be part 2, and I will leave right now a little room for some questions. Is osteoporosis genetic? No, so rheumatoid arthritis, which is like a joint disease, it's autoimmune disease. The autoimmune diseases are usually more genetic. Osteoporosis, it's not necessarily so genetic. However, if you have a family member that have osteoporosis, you could be more prone to it. It's more environmental. Vitamin D level, calcium level, exercise, especially heavy weightlifting, that makes our bones stronger and increases bone mineral density, as well as testosterone and estrogen. Those hormones prevent osteoporosis. Okay, guys, I think I go over 30 minutes. I'll talk to you soon about different treatment options. Oh, wait, there's one more question. When do you recommend getting your hormones checked? When? Anytime. I feel like everybody should know their testosterone levels. Everybody should know their estrogen levels. Everybody should know their CBC, complete blood count, and see if they're anemic or not. A hormonal panel with some vitamins that we do here at the clinic, it's for everybody. Anybody should do blood work at least once a year and make sure their all levels are within normal limits. How long do we expect people to stay on hormone replacement therapy? It depends. If people are depleted of hormones because of some trauma, childbirth, we can replace hormones and let them recover, because hormones really help our body recover and remodel. And once that issue is solved, then people can slowly wean off hormone replacement therapy. However, if people are starting hormone replacement therapy because of aging, because of menopause or dropping of the hormones, then unfortunately they have to be on a hormone replacement therapy forever, or I would say until they want to feel amazing. So when people ask me how long I should be on hormones, I always ask them, how long do you want to feel amazing? Perfect. Okay, guys, so we'll talk more about the treatments next time, all natural and hormone replacement therapy, and what we can do for aromatization, which is converting testosterone to estrogen to match. The same, we can talk a little bit more in depth about testosterone converting to DHT and how we can prevent that. Thank you so much for listening. My name is Martyna Erskine. I'm a family nurse practitioner here at Enjoy Wellness Partners. If you have any questions, you can always schedule 15 minutes free phone call with the provider here at Enjoy Wellness. And thank you so much for listening, and have a wonderful day.